So, although we can never predict, the severity of an influenza season in advance, the idea, the prospect, the potential for a severe influenza season, or even an average influenza season, compounding the COVID outbreak is very, very disturbing and worrisome, should be for all of us. I mean, there's preventable hospitalization and death from influenza. We don't really know what the interaction between these two diseases may be, and it certainly will be tremendously confusing to have many people with influenza illness, which can look just like COVID at the beginning, and will need to be tested and isolated and quarantined if they develop influenza, as if they had COVID, until COVID can be ruled out and eliminated as a cause of their symptoms and illness. So we very much want to promote increased flu vaccination in the community. So what we will be doing is increased public communications, increased marketing, increased outreach with our community healthcare providers, our community clinics, and our healthcare facilities, to try and get the message out about the importance of flu vaccine, including today's briefing, to try and raise the awareness now early, and to make sure that all of our healthcare providers have as much flu vaccine as they can use. And we do believe that there's going to be plenty of flu vaccine available through the usual channels, this vaccine, but our federal colleagues at the CDC have purchased extra vaccine through the public sector. We'll be getting extra doses of vaccine if they're needed through the public health system, so that we can do the outreach that we're planning in environments such as congregate living for people experiencing homelessness, and for long-term care facilities, and for other high-risk settings. So in the next couple of weeks, we'll be rolling out an influenza vaccination campaign on a number of fronts, both to engage with healthcare providers in the healthcare community, also the public, and also outreach to vulnerable communities and our contacts that we've been working with on the COVID outbreak, as well as those that we typically engage with during the flu season, to try and reinforce the importance of getting flu vaccination this year, in addition to what we typically do. And one of the things that's important for people to understand is we all know flu vaccine is not perfect, but it's extremely useful. It can prevent hospitalization, it can prevent death, and it can prevent people from having an illness that can be confused with COVID-19. So we really encourage all children, all adults, people with underlying health conditions, and families to please make every effort to get vaccinated this season.